Thank you, dear Savita, for the lovely introduction. Mostly the things we wanted to speak is already covered here. Anushri has told a lot. Sumit has spoken up about these things a lot. So let me introduce myself properly. I am diagnosed in 1988, 37 years back in a small town. Okay, so I have used those glass syringes. I have used Benedict solution. Okay, and whatever information was given by the doctor was hardly the dosage and all. So our topic today is doctor and caregiver harmonious relations. Okay, so how a harmonious relationship between the doctor and the caregiver, maybe a primary caregiver like the mother of the child, or we are taking care of ourselves, or for example me myself for my husband who is also a type 1. So how the things will be easier. I mean, there will not be a diabetes fatigue now we say as, okay. So there will not be diabetes fatigue because the doctor has empowered us so much. So let me just brief you about my story. I was diagnosed in a small town, okay, there was no lab at that time. I was in DKA at that time, severe coma. Then seriously the doctor told us कि कुछ नहीं है, just take the medicines, take the insulin injections and your child will be good. That was the only thing told by the doctor to my parents. So what we did, ठीक है शक्कर नहीं खाना है, done. Chocolate powder in milk, we can do it because there is no added sugar. I mean, we were not aware that I was supposed to read, I mean my mother was supposed to read the label of the product, okay, how much sugar is in that. Or shakkar is bad for diabetes, but you can have jaggery. That was the thing. So, okay, everything was fine, but I was only 7 at that time. Till the time I reached teenage, I had this diabetes burnout, fatigue. I was looking for some kind of support, and slowly, my parents, my grandparents, they were searching for some kind of support. We came to know about Juvenile Diabetes Foundation in Mumbai. And over there, we actually understood the meaning of doctor and caregiver harmonious relations. What does it mean? What is it exactly? So over there, our dear doctor, Dr. Asgaonkar, Dr. Deepak Dalal, Dr. Manoj Bhatodekar, Dr. Aspirani, we don't call them sir because they are like our uncles. We always call them uncles. Dr. Anjali Bhatodekar, our dear auntie. So that's how we have grown our relations. So with their help, with their support, now I'm a certified diabetes educator. I work in mental health. I'm a counselor. So I give my service at Juvenile Diabetes Foundation on a regular basis, apart from my private practices. So now I give it over to my dia buddy, Paras.
Thank you so much, Vaishali. Hi, myself is Paras Devani. As Vaishali told, like everybody generally, diagnosed at the age of early age, but I was little bit like luckiest person. I can say that. At the age of 22, I got this precious gift. We can say that. Yes, the same time when I got diagnosed at the time, in 15 days I lost approximately 17 kgs. In entire the diagnosing year, nobody, not a single time I have taken my insulin. I have not checked a single time my sugars, and life was going on, so on. The same time, after a year, one of my bestest friend, we can say that, he has, given me the reference of Juvenile Diabetes Foundation, Mumbai. And I just went there, alone I went there. I just thought, ki, chalo yaar, dekhte hai, we'll see what happens. Luckily, I can say that I was the luckiest person in my life. First time I met Dr. Vijay Ajgaonkar, that is my Abba, and he said, ki, yaar, you are my jam person. I don't know what he has seen on me, but after that, my life is, I can say that I'm a Koinur Hira. That's all from my side. Now our main topic is harmonious relation.
So basically, as I was telling about my story, initially we were told only about injection techniques. I don't remember that was technique was also taught to us. Just you have to inject your child, and you don't have to give any sugar. That was the only thing told to my parents. So it was very formal, formal relation, like, okay, you have this problem, take these medicines, and twice a day. That was the only prescription given. So if I had any questions, what is hypoglycemia? Those education awareness was not there. That we learned hard way. I had severe hypoglycemias many times in night throughout around 10 12 years of my diagnosis, after my diagnosis. And suddenly I came to know about JDF, and when I reached over there, Juvenile Diabetes Foundation, that was the time of our annual camp, which Dr. Anushri Mehta had already shown the pictures of. Over there, for 3 days, we will taught about different topics of type 1 diabetes, like hypoglycemia, hyperglycemia, sick day. What is sick day? What will happen if your child is vomiting and you still have to give your child injection? So those tricky questions were never answered earlier. So we were given proper education, we were given proper empowerment.
Vaishali, along with that, I'm very much sure that Dr. Vijay Ajgaonkar has kept in mind that not only diabetes management is important, but the same time mental health support is also that much required. So almost 4 decades, Dr. Vijay Ajgaonkar has established a NGO called Juvenile Diabetes Foundation along with the psychiatrist. That is more like in 40 years ago, he has already thought in mind along with the diabetes management, mental health support, mental health is equivalent important in diabetes management as well.
Right. So yes, so coming back to the story, so it was started along with Dr. Anand Nadkarni, who is a psychiatrist. He's still practicing at Thane, Mumbai. So along with that doctor, Dr. Aspirani, they all had started Juvenile Diabetes Foundation, which gave us not only all the information, all the updates about how to manage your own diabetes, but slowly after being with type 1, we have learned so much that now we both are capable that we can help others. So we decided to become diabetes educator from Dr. V. Mahan's Academy, and after few years from ISPED. And now we are in that position that we can help newly diagnosed child and their parents. Being a mental health therapist, my job is mainly to work with the mothers, right? So over here, doctor and caregiver, between both of them, the doctors have very limited time nowadays because there are so many new patients coming up. Like every day when we go to our clinic, there are within 3 hours, doctor sees around 16 to 20 patients. So imagine how the doctor can build that harmonious relationship, right? So we started making a fully fledged clinic where the dietitians will be there, where the counselor, the mental health therapist will be there, diabetes educator is also there. And it's not only about diabetes, but daily dose timing and all, but even during weekends or when the child is going out, what will you do? That timing prescription is also given to the child and the parent, right? Because that timing is different, so the sugars are going to behave in a different way. So we take care of all those things. In our clinic, we make sure that the children who has board exams, so for example over here in India, in 10th standard is very crucial year. So we make sure to tell the child and the parent, you start coming to the clinic from 9th standard on a regular basis. Come every month with your sugars, learn about your patterns, so that if your exams are in the month of Feb 2025, you have to learn how it is going to behave by October 2024. You are fully prepared in what situation, how you are going to tackle it. So it is not only the diabetes, but different aspects of diabetes. As a team, our both phones are working 24/7. because we both have faced a lot that for emergency, like I had hypos and all, there was no one to support my parents, right? So I have always told, and even Paras has told that for any emergency, you all can call up at 2 o'clock midnight. So we are always available. So we get questions like, today is child sports day, the timings are different, or the child has participated in annual day, how you are going to do? So for such small questions, they cannot rush to the doctor. So we are always available, and if we are also stuck somewhere, the doctors are always there for us. We leave a message, we drop a message, and they will 101% make sure that they will revert us back, and so that we can convey the message to the patients. So that's how we are working in Juvenile Diabetes Foundation, right?
Even the same time, Vaishali, I can say that whenever in a professional life, I work as an assistant manager in corporate company, so I have to travel so many times. So many times I feel ki, arey yaar, when I went to Bangalore or Delhi, at that time, whenever, if any emergency comes, so I'm so glad. So we have so many NGOs, so many helpers. Not I can say that, my diabetes friends are so everywhere in Pan India we have, who are ready to help us 24/7. It's all that.
Yeah, so it's not only me or Paras, but I'm sure Riddhi, Rekha, Harsh, they all are there for any questions, any emergencies. If we are stuck somewhere, they are there. If we are not, if we are in their area, they are there to help us out. So it's not the baggage is not only on the doctor's shoulders, but we are trying to share that, stress from them. Okay, we are there. The way you have supported us, we are there to support other children and to help you out over here in JDF or all over Pan India.
It's like a family, we can say that.
Yes.
It's like our closer family.
So, Diabuddy is a term we normally use and nowadays it's very trending, okay? So, what is Diabuddy? You have school friends, okay? They are there with you till your school timing. You have college friends who are there with you till your college. You have your colleagues, you can talk to them about your office work environment and all. But the Diabuddy, we will be there, or me, myself and Anushri will be there forever in life, because diabetes is part of our life and it is going to be there forever or throughout our life. So for any silly mistakes we have made or frustration, the way she said about fatigue, decision making fatigue and all, burnout, so we can just talk to them and it goes out so naturally, okay? My husband is also a type 1. So we understand each other very well. For me, I have a support of these two people, and for my husband, he has support only me. So he has no other choice. It is like that. Anyways, so this is our motto in JDF, or I think in all over India, Taya, Empower T1D, everywhere over here, Diabetes India, to help each other, learn from each other, and share our experiences. Yeah.
So, Vaishali, yesterday we got this opportunity to present ourselves in this prestigious topic, and last midnight till 3 o'clock we prepared a presentation, full presentation. We have given this entire presentation to the committee team, and last moment we thought ki, we don't want to talk theoretically or by the presentation, but no, we want to share our own experience. So we have requested Dr. Mahira ki we want to change, something in our topic. So is that okay? She has happily requested our, she has accepted our request, and we can able to share our experience with you guys. So thank you so much.
One more announcement I wanted to make here for all our fellow type 1s about our experiences, about our challenges in life. Paras is working in a corporate office. So yesterday he got a message that he has won Star of the Quarter award. So So basically, if you keep yourself in a good condition, if you are confident about yourself, you can achieve everything. You will not believe, yesterday morning I got a call from Bangalore, newly diagnosed kid. The mother is calling me up, the child is a teenager. Mother was very much reluctant to talk. She was the, I don't know from where, people comes to know that I also have type 1, and the straight question comes to, tell me your story. I started telling about myself when I was rushing because I wanted to reach here. I said, I'll tell you everything, but before that, can you just do one thing? Go to our jdfmumbai.org website, read the success stories. Please go to our Instagram handle, go through the post, and then we can talk. By evening, I got a message that I'm feeling so relieved by reading all the stories. Because sharing our experience is going to make a lot of difference for the parents, and which is going to reflect on the child as well with their blood sugar management. Because I've always noticed when the mothers are not in a good shape, they are stressed out, it badly reflects upon the child. So that is all from our side. Thank you to all our doctors. Thank you to Diabetes India. Thank you, Dr. Maida.
Thank you so much.